Hopefully, at the end of this presentation, our goal is to answer the how, when, and what. When am I eligible? How do I apply for Medicare? And once I've applied, what are the next steps? So hopefully we'll address all of these in our presentation. I would like to take questions at the end of the presentation so that we can respect everyone's time, if that's okay with all of you. And with that, Michelle has been in the industry on the Medicare side of things in that arena within the last 25 years or so, or even a little more. So she's definitely the expert, and I will be handing it over to her. And at the end, we can take any questions and questions that you may have. And with that, Michelle.
Good morning, team. So as Mercy was stating, this is an overview of Medicare and what's available. The Medicare world is a very interesting, confusing world. There are no rights or wrongs, and everyone has a particular situation or a different situation. And then in addition to that, there's different needs. So the presentation today is to be able to give you an overview on what it is, hopefully provide some education and information on a confusing topic. And then at the end, we'll take some questions and answers. So I hope everyone can share the screen, or I hope everyone can see this screen I'm sharing. Eligibility and enrollment. When can I sign up for Medicare? What are the different parts? All these questions. So normally you can sign up for Medicare when you turn 65. And you're eligible for it, assuming that you've paid the credits as an employee, as a worker in the United States. You can either apply online at their website, socialsecurity.gov, or you can call the Social Security office. Automatically, you get Part A. Part B is something that you have to apply for. Outside of this enrollment period, you can choose to delay your Part Bs, and we'll get into that as the presentation moves on. You can choose to delay Part B because you've worked, and then outside of your open enrollment or eligibility period, you can come on if you have a qualifying event. You're no longer working, you've lost employer-sponsored coverage, you've lost your spouse's employer sponsored coverage. Those are different scenarios in where you will be able to join Part A and Part B outside of your open enrollment or eligibility period, which is when you turn 65. Understanding Medicare, there's different parts to Medicare, and sometimes it's a confusing world, as I stated. So Part A basically is hospital insurance. It's going to cover anything that encompasses your hospital benefits. Part B is medical, your doctors, your diagnostics. Part D is your prescription drug coverage. So many of you have also known as Part C. Part C really is not one of the parts of Medicare Part A, Part B, and Part D. Part C is a form of supplementing what Part A, Part B, and Part D do not cover, and that's known as Part C. It's a Medicare Advantage plan. It's your HMOs, your PPOs, your point of services that are, again, going to cover what Part A and Part B and essentially Part D do not cover. Again, as I stated, Part A is hospital. This just gets into specifics. Part B is medical. There is a standard premium for Part B, which is $185 starting in 2025. If you do not enroll for your Part B when you're first eligible, you may have a late enrollment penalty. So it's important that if anyone's turned 65 or is going to turn 65 and they do not want to take the insurance because they're actively employed and they're on group credible coverage, they let Social Security know that they've decided to delay their Part B penalty-free because they have insurance elsewhere. If you do not sign up for Part B when you're first eligible and you do not have a qualifying event or a qualifying late enrollment penalty, you will be fined 10% for each full 12-month that you do not sign up for Part B. So it's always important to note that. That's what that late enrollment penalty for Part B consists of. As I was explaining before on those Part C Medicare Advantage plans, again, they do come with prescription drug coverage already built in. You want to look for the hospital, the medical, to be covered in that as well. We have many carriers, and on a national level that offer these Part C Medicare Advantage plans, but they're not part of your Part A, Part B, and Part D. They are just covering what those Medicare plans do not cover, if that makes sense. Part D prescription drugs, they all work different. They all work separate. They all have different copays. They all have different formularies. They all have different deductibles. In a nutshell, if you get your Part A and Part B, you need a Part D prescription drug plan. There's two ways of obtaining that. You can get it through your Part C or your Medicare Advantage plan, or you can get it as a standalone prescription drug plan. Either way that you obtain it, prescription drugs is the only thing that works completely different than what we have today on any employer-sponsored plans. And this is the standard Part D model that the government has to work with. But I always like to tell the members, when you're looking at Part D options, it's very simple. You're either going to pay a deductible or a copayment, depending on the plan, based on where your prescription falls in their formulary. You're going to pay that till you get to an out-of-pocket for 2025 of $2,000. And then after that, they begin to cover you 100%. That is new for 2025. Up until 2025, if any of you have dealt with your parents' Medicare, there was this thing that was known as the donut hole or the coverage gap that is going out the window. So that's no longer going to be an option, which is a benefit for any Medicare member come 2025. So it's important to note for anyone that's also going to go on Medicare Part A and Part B, and they say, well, I don't need prescription drug coverage because I don't take any prescription drugs, you have to have credible coverage. If not, there's also a penalty for not having credible prescription drug coverage. And you can find carriers out there that have prescription drug coverages at zero cost. So that's part of the process when we're researching Medicare plans and what's available. Also, to further complicate things, I want to go to my next slide because I like this slide better. Part A is free of charge. There is no cost to Part A. And when an employee that has a commercial plan like yourselves is looking at what should I do? Where should I go? Is it going to be beneficial for me? I always like to let them know that they need to consider the cost of Part B as part of their analysis because it is an associated cost that you would have if you're looking to go on Medicare Part A and Part B as an option. So Part B is based on income. It's based on how you file. There's this thing that's known as IRMA, which is income-related monthly adjusted amounts. And so this is the file for 2025. This is the chart that Social Security uses. This is always going to be a fixed cost for anyone that's getting Part A and Part B. It's based on gross income. It's based on if you file single or if you file jointly. And this would be the cost of Part B in addition to any Medicare Advantage or Medicare supplement you obtain. And again, your HR is going to circulate this PowerPoint so you can have this at the end of the presentation. And so I'm going to stop sharing my screen because at this point, I like to discuss, this is all on a PowerPoint, but really, once you turn 65, you have the option of enrolling in Part B. And if you're thinking of a Medigap or a Medicare Advantage plan, you can't do anything on those plans unless you have Part A and Part B. As I had stated, Part A is at no cost. Part B, there is a cost based on income and how you file. And then what happens when you have Part A and Part B? Because in a very confusing world, I like to tell you, you have two options. You're looking to supplement what Part A and Part B does not cover, which is basically 20% of all your Medicare, your medical cost. The two options are one Medicare Advantage plan or those Part Cs, as I just explained, which are your HMOs, your point of services, your PPOs, Blue Cross, Humana, Care Plus, United, Aetna, that offer you all the coverage to include prescription drugs already built in. And in turn, you're going to work within their network and you're going to have co-payments when services are rendered. Your second option is what's known as a Medigap plan. Medigaps are going to give you the option of going anywhere really in the nation that you want to go to. It's going to automatically supplement the 20% after you meet your annual deductible, which is $240 for 2025. And then you're covered 100% after that. The Medigaps do not come with prescription drugs. So you have to add a prescription drug coverage to that plan. And you're paying a monthly cost for the Medigap. For anyone that lives in Dade, Broward, and Palm Beach, the Medicare Advantage plans, those Part Cs, usually are at no cost. You pay your Part B, but you do not have an additional cost to them on a monthly basis. And those are basically your two options. And so, I know we've discussed a lot in a short amount of time, but that's the logistics of your Part A, your Part B, what are Part Cs, what is Part D, and how much can this scenario look like for me when I'm thinking about getting Medicare Part A and Part B. And many people ask me, Michelle, how do you start? Mercy and I always like to start with, you're thinking about going on Part B, but you don't know what your options are. I always tell the employees, I like to start with a list of the doctors you utilize, a list of the prescription drugs that you take, and we like to give you two scenarios, one under a Medigap and one under a Medicare Advantage, because it's not until I put those two scenarios in front of you that you can understand logistically how it works in regards to benefits when you're going to utilize these type of Medicare plans. And now I'll open it up for any questions anyone may have.